What if I told you that one of the biggest beliefs in medicine, that testosterone feeds prostate cancer, is no longer supported by the evidence? I'm Dr. Clifford Gluck, and today I want to talk about an important new paper published by my friend and former residency colleague, Dr. Abraham Morgentaler. We trained together at the Brigham and Women's Hospital in Boston in the 1980s. And for more than 3 decades, Dr. Morgentaler has challenged one of urology's oldest dogmas. For nearly 80 years, doctors have been taught that giving testosterone to a man with prostate cancer is like pouring gasoline on a fire. But this new review examines decades of research and comes to a very different conclusion. Testosterone does not drive prostate cancer. That doesn't mean testosterone is irrelevant. It means we've been asking the wrong question. Think about it this way. Every prostate cell, normal or cancerous, needs testosterone to function, just like every cell needs oxygen, glucose, calcium, and potassium. But nobody says calcium causes prostate cancer simply because cancer cells use calcium. The real issue is something called androgen adequacy. The prostate needs only a relatively small amount of testosterone to function normally. Once that minimum level is reached, what Dr. Morgentaler calls the saturation point, roughly around 250 nanograms per deciliter, adding more testosterone doesn't appear to make prostate cells grow faster. It's like filling a parking lot. Once every parking space is occupied, adding more cars doesn't create more parking. This explains something doctors have struggled to understand for years. Why does androgen deprivation therapy work for advanced metastatic prostate cancer? Because it doesn't lower testosterone from normal to high, it lowers it to almost zero, well below the saturation point. At that level, prostate cells simply don't have enough androgen to maintain their normal metabolism and growth. But bringing a testosterone-deficient man back into normal physiologic range is a completely different biological situation. The evidence supporting this is remarkably consistent. Large randomized trials, including the Traverse trial, with more than 5,000 men, showed essentially identical prostate cancer rates in men receiving testosterone and men receiving placebo. Meta-analyses of randomized trials show the same thing. Large observational studies involving hundreds of thousands of men show no increased prostate cancer risk.